Hello, everybody, and welcome to the latest edition of Five Questions. I'm Sarah Downey, and I'm the President and CEO of the Michael Garron Hospital. And it's my pleasure to have with me today Dr. Janine McCready, who wears a lot of hats today. One is as an infectious diseases physician, so an expert in transmissible diseases. The second is the Associate Medical Director of Infection Prevention and Control. And what's really germane, I think, also to this topic is the mom of school-aged children. So welcome, Dr. McCready.
Thank you, Sarah.
So Dr. McCready, everything we're hearing about in the news is about schools and getting kids back safely and protecting our children and their parents and their grandparents and their teachers as we move through this important milestone. So I want to ask you a few questions about kids and returning to school, if that's okay.
Definitely.
So let me start with probably the most fundamental question, and that is it safe to send my child back to school?
So definitely the question I'm getting about 150 times a day. So a very good question. And I think one thing we have to remember to begin with about everything we've learned about COVID-19 so far is that in the vast majority of cases when children do get infected, they have very mild illness. And so it's rare for children to get very sick. And so that helps us to, frame our risk assessment about kids going back to school. And the things that I think about when I'm deciding whether my kids are going to go back to school and whether I'm going to keep them in school the whole year is the first thing is really what the levels of community transmission are. And if we can all keep those levels of community transmission low, that's going to help to keep schools safe. And so right now we're in a good place. There has been a little bit of creep over the last few weeks with a little bit of increase in cases, but they're still overall very low. And I think they're at a level that we've seen from other jurisdictions that when the numbers were at this level, they were able to keep schools safe. So I'm reassured by that fact, and I'm going to be watching the numbers closely. The other fact is, as an individual and as a parent, to look at your own household and see if you, yourself, the people that you live with, the people that your kids are going to be interacting with regularly, if any of them are at higher risk for severe disease. Because if they are at higher risk for severe disease, you might have a higher threshold about whether or not you're comfortable sending your kids back to school. And then I think the last thing that I think about, or there's two more things really. One is really what my individual school is doing and what precautions are being put in place. There's lots of guidelines that Toronto Public Health has put out for Toronto District School Board and the Catholic School Board to put in place. And if you're in alternative schools, comparing the guidelines that they're following as well. So the main things that we've all heard about for months are the physical distancing, some degree of mask wearing when kids are able and not able and can do that, some improved ventilation and hand washing. So those are the key things that I'm looking for when I look at the schools, what they're implementing. And the last thing is really your child and, how are they doing in an environment where they're going to school versus virtual learning and how you can support them. So it's not a one size fits all answer, certainly. For me personally, I have a son going into grade 2 at a public school in our area, and he is going to be going back to school. And as I said, I'll be watching the numbers closely. But I think for us, that's the right decision, and I am very hopeful and confident that he can remain safe at school. And right now, we're doing a lot of practice wearing masks and practicing that to make sure he can do that.
Thanks. And I'm sure he gets a lot of mass practice and watching practice at home. What will happen, Dr. McCready, if there's a case or an outbreak of COVID in my child's class?
So good question. So the ministry actually just this week has come up with some guidance for that, and Toronto Public Health will be basically liaising very closely with the school. So the first thing is, if depending on where you were tested, if you're tested in our area, you would be called by our, or if the child was, someone would call the child, get information, and then notify Toronto Public Health and notify the school. If there's one case within a classroom, then the guidance has indicated that the other children within that class would be, or that were potentially exposed, would be sent home to isolate for 14 days. Within the guidance, and I think things may evolve, is that the Toronto Public Health will be doing kind of contact tracing within that setting to determine if there were kind of widespread exposures within that environment, or if there was able to be physical distancing maintained, perhaps for high school environments. But as for what I understand from the guidelines, is if it was in an elementary school class where we're hoping children will be able to physically distance, but certainly I don't think we can always 100% of the time rely on that. Those children would be then off for 14 days. They are recommended to get testing, but as of right now, there won't be any mandated testing within those cohorts. And again, though, I think we'll be getting some more specific guidance with Toronto Public Health once they've had time to digest the ministry guidelines, and then we'll see at an individual school level. So one case in a class would close down the class, and if you're seeing cases in not related to each other in different cohorts, then that's what they would consider an outbreak. And at that point, then it would be deciding if you could just send the classes home, or if there was more concern regarding spread throughout the school, and then they may consider shutting down the school more broadly. But I think at this point, the plan is to hopefully just try to keep things very narrow to individual classes or cohorts. And that's why a lot of the public health advice and a lot of the things we're trying to implement to keep the schools safe are really to keep the cohorts and the classes separate, so that we won't see transmission throughout the school if a case is introduced.
Great, that makes a lot of sense. So what is the hospital doing to support community schools in East Toronto?
So I mean, you know more than anyone here in the East, we're very passionate about our community, and we're very, we're really part of the community, and we kind of, want to just help all of these schools to make sure that the parents, the teachers, the principals, they all feel very supported. And so by doing that, we found through the first wave of COVID that there's so many guidelines that come down and that are very important, but it's very helpful to be able to digest that and help to translate that for the local setting. And really, I mean, I've read way too much about COVID, more than I ever thought I would read about anything in my whole life. And so I think hopefully our plan is to help to provide a resource for these schools. So far we've created some open forums with the schools in our areas. We have kind of targeted the higher risk schools that are in areas that have lower socioeconomic status, are racialized, and have multi-generational families that would be higher risk for transmission of COVID within the homes, and have we're planning to link them with a family physician and the community health center to provide more on the ground, logistical support and kind of interpretation of the guidelines. And then for our schools, we're planning to have a weekly forum for the principals to answer their, real life logistical questions as we start to go through this. And, we're working closely with Toronto Public Health to make sure all the messaging is similar. And we hope as things progress, we can have a relationship with the schools so that when they do have questions and they do have concerns, if cases arise, we can help to deal with that and really empower them and empower the principals to feel comfortable and help their staff to feel comfortable. That was one thing that really, I was reflecting on how it was stressful in the hospital, in January, February, March, and it was so unknown. And I think, I understand that stress that teachers and principals are feeling now. And so we really want to help to give them the tools to help their staff and the parents to feel like, we've got this, like this can be done safely, and we can keep everybody safe if we follow the precautions that we know work.
Right, and you are an incredible teacher about those things, and you've certainly guided our organization. And as you say, it takes a lot to adapt high-level principles to local circumstances, all of which are really different. So what would happen if my kid gets a cold or a runny nose? What's your advice?
Great. So the first thing is they can't go to school. So we want to keep all the colds and viruses and coughs and everything out of schools. I'm an infectious disease doctor, and COVID, especially in children, the symptoms aren't always classic, and you can't tell, and I can't tell by looking at a kid if that's something called rhinovirus, like a regular run-of-the-mill cold, or whether that's COVID. So the schools are going to be very strict about not letting anyone come to school and asking parents to be really responsible and and making sure that you're honest on the screening and not bring your kid to school if they are sick in any way. So if any of the even minor symptoms. If that's the case, then we would ask that the plan will be to keep children home And then if their symptoms are there, the recommendation would be to go get a test for COVID-19, or if the symptoms are very mild and you just want to see, how your kid's doing that day, if they resolve, you basically would have to keep your children home until the symptoms have resolved for 24 hours. And even if you do go get a COVID test, which I would personally recommend, because I think it'll be very useful to know if there is transmission and if we're missing any cases, then if that COVID test is negative, then the child can return to school once their symptoms have resolved for 24 hours. And so it's very important, that part too, that even if the test is negative, we still want the children to be healthy when they return to school, because if we're spreading even other viruses in the school, it's just going to create more confusion and more anxiety and more absenteeism for everyone. So we're all relying on everyone to really do that part.
Right. And do you expect to see fewer runny noses than typical?
Great question. Yeah, great question. So I really do, because I think that if the precautions we're taking are working, then we shouldn't be spreading all the regular run-of-the-mill colds, flus around the classroom. And if we are starting to see those colds and flus passing around, then that's a marker to me that we do need to worry about spread of COVID-19. We do need to kind of refresh our precautions and see where we're going wrong. And some of the data coming out of Australia, their flu rates have actually been very low so far this year because of the precautions. Interestingly, some of their rhinovirus, more the common cold, that is actually there's still been some transmission there. So we'll see if that, how that evolves. We have the luxury of watching them first and learning, but definitely I hope that the measures we're putting in place, the safety measures, will help that. And if we are seeing more cases of that, I think it tells us, okay, we need to refresh and see where we can make things better.
Great. So you talked about testing. Where can my child or my family get tested, and when should they be tested?
Great question. So in terms of where, so we will have our community assessment center open here at Michael Garron, attached to the side of the hospital. And in addition, when school starts, the second week of school, so now that school starts for TDSB September 15th, our plan is kind of the second and third week of school, so the weeks after that, to open specific assessment centers in Thorncliffe Park and also in Crescent Town, to kind of give some geographically more accessible locations for those communities, and other people are welcome to go there if that's closer to their home as well. So that's where we'll have the ability to test. And obviously there's also assessment centers around the city if you don't live in East Toronto. So easy to go on and search for those. A lot of the other all the other main hospitals also have those assessment centers that are providing that service. So, and then in terms of when to get tested, so ideally, if you are symptomatic, it is best to get tested as soon as possible, because if it is COVID-19, then that will facilitate contact tracing, being able to notify other people, and then to also facilitate, making sure that everyone in the household then isolates if it is that. If, for example, your child has COVID-19, if your child has symptoms, but you don't have any symptoms, I would recommend testing the child, but you don't necessarily need to get tested at that point. If the child then, or someone your child was in contact with was positive for COVID-19, then there's kind of a few different times when you could get tested. If you know that your child's been in contact with someone for a few days with that, it may be reasonable to take them to get tested, right away. Versus if you just had a contact with someone that had COVID-19, say yesterday, and you are completely asymptomatic, then ideally you'd wait 5 to 7 days before you got tested. Since if you do it too early, you're not gonna pick up any transmission of the virus. And if you are exposed to a confirmed case of COVID-19, either that public health calls you and tells you, or you get a notification on the COVID app, then you can go get tested I would ideally recommend 5 to 7 days after the exposure, but then you still have to isolate for that full 14 days. And I'll give a little plug, since I remembered, for that COVID-19 app. So it's another tool in our toolbox for the fall. So anyone that has a smartphone, you can go on the App Store and download it. And I've downloaded it. It's great. It just checks privacy. They've done a very good job with privacy concerns. And
I have it too. Listen, thanks so much for taking the time to answer these questions. I know how much everything in this landscape is changing. The science isn't changing, but the application of policies are very tricky. We understand that. So thanks for taking time today to explain to us what's at the basis of keeping our children and our families and our communities safe. Thanks, Dr. McCready. And that's it. Thanks for participating in another 5 questions with Sarah Downey, and we look forward to seeing you again soon.